Implementing OMT or oral myofunctional therapy into your dental practice can be a profitable system where fee for service you can make at a minimum $230,000 a year just implementing it alone. My name's Carice Laguerre. I am a registered dental hygienist, a key opinion leader, myofunctional therapist, and I am here to answer all of your burning questions about myofunctional therapy in your dental practice. So let's dive in. What are the benefits of myofunctional therapy in the dental practice? There are a myriad of benefits that extend well beyond that of profitability. I get bottom line absolutely means the most when we are talking about dental practices. They're not nonprofits. You have to make a profit, right? You have to actually be profitable in order to support your income, the staff's viability and their homes and being able to support their homes, and the viability of the business as a whole. And so the benefits actually do extend to that outer network. It's like a ripple effect. So we have patients. Patients are actually benefited significantly by myofunctional therapy. Those are in orthodontics. You'll find that the soft tissue pressures are actually creating an undue influence sometimes and counteracting a lot of what you're trying to do, whether you're doing clear aligners or traditional orthodontic systems with brackets and arch wire. You'll find that those patients with tongue thrust, parafunctional habits, TMD, oral facial pain, a lot of them will benefit significantly from myofunctional therapy and being able to facilitate better use of their oral musculature. It actually doesn't help the outcomes of other dental traditional restorative methods because with less parafunctional habits, there's a decrease in periodontal disease and restorative treatment breakage. And so you're able to get more successful outcomes for your patients, and they get a wonderful benefit for their systemic and overall health. There's also a benefit for staff retention. All of the surveys, I get it. There's significant amount of surveys between the ADHJ and then all of the top leading consulting firms. Deloitte had a survey, and a lot of the clinicians in the dental field with our staffing crisis are leaving because there's not enough variability in their career. Most of the dental hygienists are getting burnt out and expressing that what their issue is that they're at a ceiling. They've done all they can do in their career and they want more out of their life. Myofunctional therapy has actually been a really great way to bring in your dental hygienist as a partner in growing the business, and by offering them something more fulfilling to do with their role. So they're hygienist and they get to still practice in their passion there, but they also get the opportunity to help patients on a deeper level with myofunctional therapy. It winds up being a wonderful way to revitalize a career that otherwise might have left them looking for other alternatives. And then we know that if that is something that they are practicing and it's something they get to do exclusively in your office, and only 1% of dental practices are actually implementing myofunctional therapy, there's no competition. There's nowhere for them to go. So you find that there's an increase with staff retention and loyalty. And then you'll also find that the competitive advantage of being able to offer something that only 1% of your competitors in your area are offering is a phenomenal way to differentiate your practice, to stand out and to allow more patients to come in, because we find in the next question, is there a demand? The demand is so high. Is there a demand for myofunctional therapy? Yes, absolutely. A resounding 100%. The National Institute of Health did a survey that found out that 1 in 3 Americans are actually looking for more integrative services in their medical and dental practices. A lot of the oral health and wellness, all of that is driving the systemic health. And we know that we can be at the front line because dental hygienists are really the most visited healthcare provider, only second to pharmacists, but most visited healthcare provider by healthy individuals. So these healthy individuals that might be struggling with sleep problems, temporomandibular joint disorder, oral facial pain, headaches, morning headaches, they are in your office already. You are already seeing them at a consistent basis, and being able to offer them something now on top of what you're already offering them puts you as a standout provider. And in a society where Google is really leading the way, where we're more likely to go to Google and trust Dr. Google than we are to trust Dr. Smiles in the dental office, we know that having that advantage of having an integrative service is going to be the leverage that you need with your patients in this competitive society where we are looking for better and overall health and alternative options. Now, question number 3. I know this is a big one. What are the costs involved with implementing myofunctional therapy into my dental practice? Unfortunately, dental providers are 3 times more likely to lose their investment in myofunctional therapy training, education, and implementation than any other professional. And we know that speech therapists, occupational therapists, and physical therapists are practicing myofunctional therapy, and they're more successful at being able to integrate it. What's lacking is honestly the systems, and we'll get to that in just a second. What's lacking is the systems. And in that is where you're more likely to lose by not having a consistent system. You're more likely to lose your investment. So what's your initial investment going to look like? It depends on which route you go. If you're just going to send a team member or perhaps yourself to a myofunctional therapy course, you're looking at anywhere between $2,500 to $4,000 for most courses. But the course alone is rarely ever enough. It's a lot of didactic information without any actual clinical implementation. So 1, you don't know how to really implement a system because systems are not taught in most myofunctional therapy courses. There's a link for a great one where a system is taught and where you do get some on-site instruction. And 2, you're missing on-site instruction. You don't get that clinical experience. Can you imagine having been in the dental school and you only did the coursework, you were only in the classroom and you never got any clinical hours, and they said, okay, well, you know all the information up here, so it should transfer to these, so go be free and do dentistry? It would be bizarre. And that's exactly what's offered with every myofunctional therapy course, with the exception of one now that has that actually wrapped in with 16 hours of on-site education. It's lacked all of the clinical experience and guidance that we as type A and tactile professionals really, really need in order to succeed and to thrive. Okay, so what are the challenges? The challenges definitely include, if you are taking a course or if you are implementing it without any sort of structured guidance, so you don't have a system, the challenge is going to be creating a consistent patient experience. We know that that patient experience is actually the #1 driver in why people return. They have to trust their providers. 70% of people, as per the ADA, 70% of your dental patients are returning because they trust you. And when you start implementing things, especially something that's more integrative and then really requires some patient education and some proper nurturing, that way the team is consistent with the education and how they are implementing, if you fail there, you're going to risk losing trust with your existing patients. But those who you do have a good system for, and they have a consistent patient experience, and they understand appropriately why it is that you have implemented this, this is going to be the real driver for not only their increased happiness and retention, but for them to increase your organic marketing, word of mouth. That's the key, right? That's what we really all want at the end of the day, that word of mouth. Okay, next question. What are the legal and regulatory considerations for having oral myofunctional therapy in my dental practice? Well, interestingly enough, there are none. There is no legislation that actually regulates and no regulatory body that rules over oral myofunctional therapy currently. You can kind of liken it to yoga or like personal training. So if you were to go and your staff became a yoga instructor, yay, hooray for them. But like your dental board doesn't rule it. There's no yoga board that you can consult and be like, oh, well, you know, how do I navigate this? It's actually a little bit of a free for all, right? Which is great. And it's also bad because it leaves too much gray area. And so understanding the scope is essential, 100% essential. And so what you really need to know to really answer this question is that myofunctional therapy is not a part of, as of the recording of this video, is not a part of any of the dental state practice acts in the USA. So all 50 states, not one of them, have implemented it as a part of the scope of practice. What we have had is dental boards who have met, and remember, these are regulatory bodies, not legislative bodies. They have met and they have determined it is not in the scope, it's not written into the Dental State Practice Act, so it has to be performed separately. okay? And if you want to know what states they are, please, I'll leave my link down below. Schedule a meeting with me. I'm happy to talk more to you about your state and what may potentially be a factor for you. But they have to be performed separately. So just as long as the two don't mix, you can't have your fillings and then at the same time, while you're doing restorative work, start prescribing some myofunctional therapy exercises. Those two don't blend. There's a very intricate weaving of the two to help them intersperse better. Okay. All right. Last question. How can I learn more? Learning more is essential to being able to understand before you make a real decision about how you can implement it into your practice. I would love to chat with you and we can have a quick 30-minute call. And during that time, I can learn more about your area and what's going on and potentially do a market survey for you, complimentary, and be able to give you actual advice that suits you and what it is that you're looking for with myofunctional therapy and find out the true profitability for your area. And so I'll have my link down below. Feel free to book a meeting with me. And I really hope that if you have any other questions that are burning and you really would love them answered, that you would place it down into the comments. And don't forget to like and subscribe to my channel. I will be back with lots more videos in order to help you educate and appropriately determine whether or not myofunctional therapy is great for your practice.